tonight. The Oregon Health Authority is stepping up its response to an emerging public health threat. There are more than 7,000 cases of monkeypox reported in countries where this disease isn't normally a problem.
More than 600 of those cases are happening right here in the United States. Doctors think we'll see more cases in the weeks to come. Fox 12's Anna Katayama joins us now with more on the story. Anna?
Yes, most of us have heard of this disease referred to as monkeypox. But to keep consistent with the World Health Organization, Oregon health authorities are referring to monkeypox as HMPXV. And they think this disease is much more widespread in the community than the current numbers show.
I heard on the news that it's spreading, and so at this time, anything that spreads fast and has health concern is concerning.
In a world that's already weary from COVID comes a new threat. Doctors say thousands of cases of HMPXV are showing up in places where the disease had not been a significant problem before. The symptoms of HMPXV include a skin rash, fever, headache, and swollen lymph glands. Oregon has 1 confirmed and 5 presumptive cases of the disease. The cases are in Multnomah, Washington, and Lane counties, and all of the patients are men.
We think the people who have increased risk of exposure are men who have sex with men, including cisgender and transgender men who have sex with men, as well as transgender women who have sex with men who have had more than one partner in the last 2 weeks.
But it's important to note the disease can infect anyone. Health officials say high-risk groups will be prioritized when it comes to the currently limited supply of vaccines and treatment. Kids under the age of 8 and pregnant women are among those considered to be at high risk of severe disease should they become infected.
I think we're definitely underdiagnosing HMPXV cases at this point in time. And because there's underdiagnosis, there's likely transmission that we're not picking up. So I do feel that there's probably a good amount of community transmission occurring in Oregon that may be unrecognized.
HMPXV is transmitted through skin-to-skin contact and sharing towels, bedding, or clothing with a person who has symptoms. It can also be spread through large respiratory droplets. The incubation period is usually 6 to 13 days, but it can be as long as 21. HMPXV can be deadly, but doctors say that's rare. Still, word of another disease spread is concerning.
I don't know anybody personally who died from COVID, but just this fear of anything unknown is pretty significant.
Back live now, there is an antiviral treatment known as TPOXX that's currently available for folks at risk of serious disease. But in the entire state of Oregon, there are only 25 doses or courses of treatment available. And there's also 2 types of vaccines. Cities such as San Francisco and New York have a significant number of doses, but in the state of Oregon, we have only 193 vaccine doses available. Live in the mobile newsroom, Anna Katayama, Fox 12 Oregon.